Hi everyone, this is Commissioner Winston Barnes in the great city of Miramar in Florida. May is observed as Stroke Awareness Month, and this year we have a special feature for you in this production we put together. I'm joined today by someone who has been a guest on my radio program for a number of years talking about stroke awareness, and we're joined by a doctor who specializes in the neurology of stroke and the management and treatment of stroke. Let me introduce Carol Hilton of Smiley's Voice Foundation. Tell us a little bit about yourself and what it is that you have done these many years.
Okay, so my name is Carol Hilton. I'm the president of Smiley's Voice Foundation. We're actually the only stroke awareness foundation in Southwest Florida. And our organization was founded in 2010 after the loss of our son, Michael Hilton Jr. Many know him as DJ Smiley. He was 29 years old when he passed away from a stroke in November 22, 2009. It's been that long. So it came to the forefront for family and friends. They were very stunned that someone that young would have had a stroke or even died from a stroke. So it was always thought that stroke was an old person's disease, you know, it only happened to old people. But that basically brought it to the forefront. And we as family and friends decided that, you know what, we needed to do something for our community to increase our community's awareness of stroke and its impact. So we founded Smiley's Voice Foundation. So what have we done? We have partnered with institutions like Memorial Healthcare System, which we have Dr. Norman Ajiboye, who is a neurointerventional surgeon at the Memorial Neuroscience Institute.
He will talk
for himself. But I'm just so proud to have him here with us again this year, and for the support that they have given our organization throughout the years, helping us to do health fairs, health screenings, blood pressure, cholesterol, all the screenings that really impact strokes. Organizations such as Catholic Health Services, Baptist South Florida, they've all been on board to support the cause of educating our community on stroke. And our foundation also supports students of nursing. FIU has benefited their students of nursing since 2010. We've given over $13,000 in scholarships to nursing students. We reached out to Jamaica a couple of years ago. We gave some scholarships to medical students attending the University of the West Indies, and also a nursing student there as well. So over the years, we've given maybe about $20,000 or so. We're a small organization and growing.
But that money makes a difference.
It makes a difference. And, you know, from time to time, we get a call. You know, I have a loved one who had a stroke. Their insurance has run out or is about to run out. They need some financial assistance. We've been there for them. You know, as recent as a couple of weeks ago, I got the call. You know, this person, the insurance dropped him, no ability to get the therapy that he needed. I have people on our team. I have therapists on our team that I call and I'm like, listen, I said, I have somebody here for you. And they're, you know, willing to do whatever they have to do just to make an impact on the life of a stroke victim. And I say victim because sometimes they're considered victims. So we're there, financial support, and I have to thank the community for really donating to our cause so that we can live that mission of making a difference in the lives of many through stroke awareness and education programs, to give the financial assistance that is needed. It could be for a funeral expense, it could be food, it could be anything, you know, and we help them to navigate the system, because when somebody has a stroke, the family is, you know, they're so in disarray.
Where to go.
They don't know what to do.
And
that's another thing that I do thank the Memorial Healthcare System for. Dr. Brijesh Mehta, he's the medical director for the Neuroscience Institute. He's there all the time. I can call any time of the day or the night. You know what, I have a family who just had a loved one who had a stroke. Can you talk them through this? And he's never more than a phone call away to respond to the needs of the people who reach out to us. So I have to be very thankful.
Yes. I've interacted with yourself and Dr. Mehta over the years, and just the impartation of knowledge, of information, has been just incredible over the years. And I want to say, we thought he was just a fit-in last year when we got Dr. Ajiboye on board. Dr. Norman Ajiboye, please introduce yourself to our viewers.
Yeah, this is Norman Ajiboye. I'm a neuroendovascular surgeon here at Memorial Hospital. Thanks for the introduction, sir. I did my training up in Philadelphia at Thomas Jefferson and did my fellowship at Texas Stroke Institute in Dallas. And then I came down here to South Florida, sunny South Florida, about a year and a half ago. And my passion and my excitement is always around stroke and stroke care in the U.S. I have been fortunate enough to work with mentors and also with mentees and with the great staff here at Memorial Regional as well as Memorial Miramar and Pembroke as well as West. The area that I focus on is typically early recognition of stroke, stroke education to the community, as well as to EMS, and also education and training of staff and future stroke doctors. I take care of kids as young as 2 years old, even infants, all the way up to our 100 years old, 104-year-old patients as well. I think early recognition of stroke is quite important because even though it's a devastating disease, about 80% of strokes are preventable. So if we can be in tune with our body, if we can do the right thing, we can hopefully reduce the risk of stroke in the future. I do both the medical and also the surgical management of stroke in terms of medications that help reduce or treat stroke. And also I deal with taking out the clot, if when we do have clots in the brain that causes a big stroke, I also specialize in taking that out to help improve survival and reduce the risk of disability. So I'm really excited to be able to join you guys on this show today and be able to educate you about stroke.
Dr. Ajiboye, you mentioned early detection. Tell our viewers, our listeners, why early detection is so important in the management of strokes.
So if you're able to think about, blood vessels in the body as being sort of a pipe that delivers, important nutrition to a different part of the brain, you need nutrients and you need oxygen to the brain, then you know that early detection is very important. There's that phrase called time is brain. And the reason early detection is important is if we can get to that stroke in a timely fashion, if we can take out the clot in a timely fashion and restore blood flow to that area of the brain that lacks blood flow, then there's less risk that that part of the brain will be damaged. Think about it. We have over tens and thousands of, over billions of neurons in our brain. And every 60 seconds that passes by, every minute that passes by, about 1.9 million brain cells die and they become irreversibly damaged. Mm-hmm. If you wait, the longer you wait to be able to get proper treatment, the more brain cells will die, and the more those die, the increased risk of disability and the reduced chance that you can go back to your baseline. So that's why we really educate EMS. We go out in the community and educate EMS and also educate people in terms of early recognition of stroke symptoms. When you recognize it, you call 911 early, and the EMS knows to call us, even from the field, to let us know that, we have a possible stroke coming into the hospital. That way, we start getting our staff together, we activate the team so we can get to that stroke within the golden hour. And that's very, very important because that increases your chances of survival.
One of the things I'd like to come back in a moment is you're mentioning not only the time frame being as short as possible, but I want to also ask Carol to come in and talk about why it is important to be able to go to the right institution.
Yes. And, in 2009, when my son passed away, the thought process was, or the protocols was that the person should be taken to the closest hospital. But the closest hospital may not be equipped to handle someone that's having a stroke. So over the years, with Dr. Mehta, Dr. Ajiboye, and their team, they've actually educated the emergency management services. And now we've seen much more movement with, actually, I think all are on board right now to make sure that they identify that the person is having a stroke and actually taking them to the comprehensive stroke center that's prepared and equipped to handle. And Dr. Ajiboye, to handle the strokes. And Dr. Ajiboye also mentioned they're also using technology, the iPhone, the phone, actually showing the team at the hospital the picture of the patient so they can start diagnosing and preparing for the patient. So when the patient arrives, they're ready for the patient.
One of the really neat things about being involved at the level I'm involved in at the city is that you understand that the entities that cost the most money are fire and the police. But Dr. Ajiboye will remind us that the treatment actually starts when that victim actually enters the vehicle, long before he or she gets to the hospital.
Right.
Talk about that for us, Doc.
Yes, early treatment is very, very important. Certainly, when the EMS comes over to the house, they check glucose, they check blood pressure. It's also important because if they see certain signs and symptoms and they think there might be a large vessel occlusion based on certain things they do on the exam, we've also advised them to start getting IV access. And IV access is important because the way that we can see there's a big blockade of the vessel in the brain is by injecting a contrast material into the vein when they get into the hospital so that we can detect where the blockade is along the vessels in the neck or in the brain, so that having IV access while they're traveling from the house to the hospital, it's really important because anything you can do to save time and get to that clot in time helps improve your chances of survival. So, and also when they get to the hospital, we also make decisions about giving certain medications called IVTPA, which is the clot busting medication, and that can only be given within a certain time frame. If you're outside the window, meaning that if it's been long since your stroke has been going on, then the advice is not to give it because you can actually increase the risk of bleeding into the brain. So there's a lot of things that the EMS kind of helps, to do while they're out at home, and that helps improve, the patient's survival and helps shave time off in terms of us getting access to the clot within the brain.
Well, one of the things that I've noticed across our community, and I'm a little angry when I see it, is people who are obvious stroke victims walking with assistance, sometimes with a stroller, with a cane or whatever. Talk, if you would, Doc, the value of exercise in individuals regardless of their age. Talk, if you would, about that.
As I mentioned earlier, even though stroke is a devastating diagnosis, the silver lining is that 80% of strokes are preventable. So one of those preventative measures for stroke is exercise. And the American Heart Association guidelines recommend at least 30 minutes of moderate intensity exercise each day for about 4 to 5 days per week. So, and that helps reduces your risk of a stroke or even your risk of a heart attack. That helps reduces worsening high blood pressure. So there's a lot of benefit to exercise in terms of what it does to your overall health.
So, Doc, tell us the solution then for those of us who work in stressful situations. What do we do? Is there anything we can do?
certainly, work is stressful, and also that's been compounded by this, the pandemic that we had. A
Mhm.
lot of situation issues, a lot of problems. I think the best way is just having a good supportive, social network.
Okay.
That is very, very important, having your loved ones close by or being able to interact. And for those that cannot do that, certainly exercising, eating healthy. I know it's sometimes hard to have a sunny disposition to life because of factors that are beyond our control. But I
Mhm.
think a big part of it is just certainly having a good social network and trying to stay healthy and exercise and find out where your passion is and see if you can go for that as much as possible.
In other words, Doc, when we hear and read about the impact of loneliness because of the pandemic, that bears some examination, right?
Yes, yes, I agree. I agree. There's increased risk of psychiatric illnesses and diagnoses coming into the hospital relative to other medical conditions. And there's a reason for that with the pandemic and what's going on in life. But I think certainly there are ways we can mitigate that, and it's sort of finding that social circle and finding your network and being able to be around loved ones and people that understand you and you understand, so as to and the state of mind, the overall psyche also contributes to how healthy you are. So it's always important to be to be well balanced in terms of things we do.
If you're a viewer and you're just joining us, I'd like to reintroduce my guest to you so you have an understanding of what we're not only talking about, but the specialists that we're having this conversation with. Carol Hilton has become a good friend of mine over the years. She represents Smiley Voice Foundation and neurointerventional specialist. Oh, I got it right.
That's right.
Dr. Norman Ajiboye. If you're just joining us, we're talking about this being Stroke Awareness Month. One of the things, Carol, that caused you to come into my sphere is that you, once upon a time, and of course, like everything else, got impacted by the pandemic. You had a banquet every year
Yes,
that raised money for your
correct.
foundation. Talk about that.
So since 2019, we have not had any major fundraising activity, and the banquet, of course, was out. We are looking forward to having it
Starting.
this year,
Okay.
and actually to have a more of a presence in the community in terms of the health fairs and all of those
Right.
things. So we're in the planning phase now. We're planning a 5K walk, run, crawl,
Right.
whatever you
Move.
can do, to keep that focus on the exercise component, the physical activity, like Dr. Ajiba you mentioned. And, I know I spoke about the fact that everybody was so surprised that a stroke could have affected a young person. But also, too, it's a major, major issue for women.
Ah.
A major issue for women. It's the fourth leading cause of death for women in the United States.
Which brings me to a question for both of you, you included, Doc. In your years of having to deal with stroke and stroke victims, what you think is the one thing that people are surprised at when they get a particular piece of information about stroke? I mean, obviously the age of someone is a surprise for many, but what else?
That was just what I mentioned, that so many women are
Yes.
impacted by strokes, and black women on a whole also more so than any other racial ethnic group
Grouping.
is impacted more so by strokes. And we as black women have a more terrible outcome, in comparison to the other ethnic groups. So they're surprised that more women die from stroke yearly than breast cancer.
Wow.
That was a surprise to many. But yet there is a major focus on prevention of breast cancer, of course, and treatment.
Yeah.
But we need to have that focus on stroke as well.
Dr. Ajiboye, you probably want to respond to that question as well.
I've seen some of the ones that actually surprised me and also surprised them will be sometimes we have people that are completely healthy. At least they work out pretty well. they seem fit, they have a low BMI, they're not obese, and you see them and they have a stroke, and then they're surprised that, wow, why did I have a stroke, or why did I have a heart attack?
I might as well stop exercising.
Oh, no, no.
No,
He
no,
says,
no,
"Oh,
no,
no."
no.
That would not be my recommendation. The other side of the spectrum is that I've seen people that are completely healthy, but also the important thing is sometimes we have genetic components. Someone might have maybe something that's wrong with the connective tissue, because the body and the blood vessels are all made of connective tissue. And if there's something that runs in the family that doesn't declare itself until maybe they're like, an older age or in midlife, then that can present as a stroke. Also, I've seen people that are healthy that work out vigorously have a stroke, because sometimes you can actually have a tear within the vessel called a dissection. So those are things that maybe I've seen something that has surprised me, and they are surprised that they have a stroke as well, either because they have a predisposition to having a stroke because it runs in the family, or they moved their head a certain way while exercising, and that resulted in in a tear in the vessel.
So, Carol, as we observe Stroke Awareness Month, give us the kind of advice you think our residents, the entire larger community, need to be at least looking at as we make this observation this month.
I think we should all be looking at the risk factors of stroke, diabetes being one of them, sickle cell anemia. It's a major
Something
contributing
endemic
factor.
to our specific ethnic
Absolutely,
group.
which we have no control over.
Right.
Okay. High blood pressure. Now that's one of the biggest risk factors of strokes, and a large number of people in our community has high blood pressure.
Yeah.
A large number has diabetes. Okay, so you have the diabetes, you have the high blood pressure, you have the smoking, the obesity. Those are major. Another major factor, risk factor, high cholesterol. High cholesterol. So we have to.
We're talking about lifestyles.
We talk about lifestyle.
Yeah.
We're talking about lifestyle. Making sure that you're following up with your physician at least once a year. Making sure that you're monitoring your blood pressure and understanding what the normal numbers are. It's anything less than 120 on the top. We say the top is the systolic, but we shouldn't say top for the regular people, but the systolic pressure less than 120, that's what you're looking for. Everybody wants to be at that 120/80. Nowadays, it's like you want to be less than 120/80.
As
But
much as
for
is
sure, 80, you don't want to be above that. Because what
Because
it means...
we're told as well, the bottom one is probably more important.
The
At
bottom
least pay
one,
attention to it.
you know what? And for years, we've all been looking at the top number,
Yeah.
right? But the bottom number is when the heart is at rest. So when the heart is at rest and
it's doing
the
good.
pressure is high, you know you're at risk for something.
Okay.
Okay? It could be cardiac and it could be a stroke.
Wow.
Yes. So that piece of information, it's just been coming to the forefront lately because we were all so concerned with that top number. Oh, it's not bad. It's 120. But that bottom number is creeping up. And a lot of people don't want to take their medication, and I know.
No, that, Carol, is for another segment.
Okay. Take your meds.
But it all comes down to lifestyle and cultural practices.
And cultural practices. Yes.
Wow.
And I know we like the medicine, the herbals and stuff like that, but tell your doctor if you're taking herbal medicines.
No, just remind them that a lot of the medicines they get originated in the herbals anyway.
That is true.
So.
But it's very hard to kind of just throw the tea together and figure out, the right amount that's going to impact you.
Exactly.
That's
it's not
the
as
piece.
if it doesn't help, but you
Right.
don't know the specific amounts that you need. Carol, listen, thank you so much for being able to spend time with us.
Thank you.
And I want to say a very special thanks to Dr. Ajiboye as well for helping us to not only impress upon our residents, our viewers, that May is Stroke Awareness Month, but the explanations behind a stroke and what one can actually do
Absolutely.
to prevent stroke.
Yeah.
And as a municipality, I've also gotten more reasons to give my residents why they shouldn't bawl too badly about the taxes, because it pays for stuff like our fire rescue vehicles.
Yes.
It's been our pleasure as
Yes.
usual, and
Thank you
so
so much for inviting me. It's my pleasure as well.